that operation nga balak when mingin 2 months nakanda iko kien met chang pe en kondit kuden hydrocephalus kichomaji so gage operation ke kindegi lo shunt ki drain the fluid away from the brain to the stomach ki bypass ki gure bypass and saya ametoka kwa gure paku ke monitored for a few hours so kwa migamet kinyoru transfers to hospitals kama huyo ametoka Kabarnet amekuwa rushed alianguka jioni at about 3 kaanguka kwa kichwa kwa bleeded so there are a lot of bleeding in the brain so now kama chege operation kista the blood in the brain. That is the emergency now for KASS. Kim to go to the patient from ICU and in a short while later the activity in the meeting. All the team is here. There are almost 15 people. So the machine is there. The machine in you only. Can operating microscope. Machine authority in terms of accuracy. Never accuracy. So we don't make any mistakes. It's a very expensive machine, but we invested in it specifically to improve. Once Kogi Kidechi Tagoro could need the name Negochingo Rista, our version came on during the operation. So we'll remove the skull out. Because the brain is swollen. So we'll keep it out, the skull out for a few days, up to weeks before we return it back. That will allow the brain to swell out so that doesn't cause further damage and more injuries to the brain. Preparation for surgery is very expensive. First of all, good diagnosis. Can make sure can get the right diagnosis of that patient. Kage CT scan, kage MRI gomni, kage chikilage discussing got came again a decision kede. This one, kimuchige surgery, and another go surgery. What's kage that decision? Nuga 100% gele. This patient come surgery. Came the next step. The next step kage make sure gele that patient go fit for surgery and not fit. So nyalo make chagan gele. Une mugulel dabjito. Une saramo. Une metabolism, diabetes, one of the things chegani vizuri kama mugo no complications during surgery. Other conditions moja complications. So lazima kubun a patient those steps could get clear angle this patient now could fit for a long surgery. Brain surgery go more easy. It's a very delicate surgery and very complicated. So a patient must be ready to undergo that process. Ako mangone surgery ko fit. So fitness is a factor in vizuri. Now, apart from that, we make sure we allow the relatives. This patient, what are the risks? Risks of surgery go une. Outcome go une. After surgery go une the outcome. All that colasmo counseling, psychological counseling about relatives of the patient. Finally, WHO checklist. Taken all the boxes necessary to surgery. For the staff, we are always ready. There must be before surgery an anesthetist quite ready the patient during surgery. That person goes before surgery, much earlier before surgery. Make sure that patient go fit, is it ready ginde tube, all those the lungs ready to undergo the operation during that process, undergo ventilation. All that is very important. In terms of the personnel, always there must be a surgeon, the main surgeon. Or lazima be assistant surgeon. Or lazima be at least 2 nurses. me an engineer, a biomedical engineer. I'm on machine is go earlier due. You don't want to do surgery, so one of them in the process. That's a disaster. So there's an engineer never can ensure all those things are in top condition. You can make it it's just a matter of switch on, off. And finally, runners to make sure in case they run. So they are called runner nurses. Again, support team, whichever support team, is there water, is there ventilation, who there go and theater, all those collars for me. So it's a big team they own there. If you come to our theater, you get more than 10 people. But each person would do KASS union. Everybody must know their work. And that's how we achieve success, because everybody must be thorough and KASS in there. Immediately I get that operation. It's a process. One day in London, you cannot just land, go crash landing. Keep the patient, London is good. So, me a place post surgery recovery space. So after that, Kimuchita to that area where there's monitoring, me and us stand by, came back and monitoring that patient for at least 8 hours. Some of it any complication. Because much of it bleeding, much of it breathing problems, all that is possible. So for safety, we always make sure the first 8 hours monitoring the patient in post-anesthesia recovery area. Again, big the spine operation, they are what you call mashartis. Especially spine. Chest is never for Tanabachita, who chest is now bagari. Close last market carry kapasa got healing community. Got come healing, no problems and complications. So one of the things we always look into kapisa thoroughly, the position, never the patient, or the waga. Things like mattresses. We always look critically at the home environment. Who needs the mattress? The mattress must be of the right specifications. Much mattress ne loose after surgery. Ne it sinks. No problems. It has to be a mattress ne firm. And I'm going to go and continue mattress. Those are things. Toilet is very important. Go on after surgery. Ko mamaje chita kwa toilet number pit latrine because of the squatting, expanding. So we advise always either fabricating a proper toilet and I got the normal sitting toilet number kawaida. Shower. The shower lazima kwa standing shower because we don't want our patients bending after surgery to go and bath. Straight the back. Yeah. Exercises. So lazima me space never mazoezi, either around the compound or outside the compound where it's safe. Smooth the rocks. Smooth means even. Mami to rocks, mami bottles, because it's important that person after surgery go no complications. So those are the basic things. Like hygiene generally. Hygiene is very important. Our calling is about life, saving life. First and foremost, saving that person. Because injury, we focus on that life saving. And I for that person go back to function. Taking care of his family and his children. That's our greatest happiness. Come on, kita in hospital, akwaga functional kwenda chitana kwenda kwenda is a greatest happiness. Ana chitana kima uere si anaenda nyumbani kama anaona, that is our greatest happiness. And there are many cases which are saving their sight, saving their walking, saving their lives, and they are back to the community doing the normal things people do in the community. That is our greatest happiness as a hospital, more than anything else. When they come back with a chicken, Agole, we thank you for this. We don't have any other money like any chicken. More important than anything else. Because that person, yes, just like in the Bible, how many, only one came back after 10 people. So we see such people that they come back, showing their gratitude after they have gone back home. And there are many such cases, examples.